Okay. Hello, my name is Jirvi Patel. I'm here representing Krish Hope. Krish Hope is a nonprofit organization that provides service to differently abled populations. Today's webinar, we're going to be talking about managing the range of motions during COVID. I am joined by JASLEEN, who is a registered physiotherapist in Brampton. She is the founder and director of Vital Care Physiotherapy in Brampton. She graduated in India and she's been servicing the community in Canada for the last 10 years. Would you like to say something?
Thank you, Durvi, for this lovely introduction. Hello, friends. My name is Jazz, and today we are here for our webinar on how to manage range of motions during this tough COVID times. So I'd also like to thank Krish Home Services for giving me this lovely opportunity. All right, so let's start. So as you guys know, that today's topic is how to manage range of motions during COVID. So as we know, range of motion is a part of a rehabilitation care, and for that I will explain you first why rehabilitation is so important. All right, so let's go to next slide. So as we know, this is pandemic happening these days, COVID, or the COVID, right? COVID. So rehabilitation needs of the people should not stop because it's pandemic, right? Everybody needs rehabilitation, it's essential. And as we know, rehabilitation should be available, readily available, accessible and affordable. So because of the COVID, it's hard for the people to get their rehabilitation needs. So I think this is a really good opportunity by performing webinars, so people can learn and they can take care of their health.
Yeah.
Right. So next we do have one little clip which I want to show to my clients. Let's play the clip. Passive is when some external assistance, right? And active assisted is both, like when the patient provides some effort but also receives assist from the outside source. Next slide, please. So this is what I explained that what is range of motion, because before we start we should know what range of motion is, right? And the next slide we say that what are range of motion exercises. So range of motion exercises are help to improve the movement of a joint, and they are very essential, and they're very essential part of rehabilitation, right? Same thing, they're also called Rome exercises, and there are also 3 kinds of range of motion exercises, which we will show in, right here. Next slide, please. I think it's in the next slide, right here. Yes. So So it is, as we discussed earlier, that it is helped to improve the movement of a specific joint. All right, next slide, please. Yeah, so what is the importance of range of motion exercises? Range of motion exercise help to maintain the mobility of the joint and flexibility to improve the joint function. And regularly you have to move your joints. Like in our daily activities, we need that flexibility. Like for example, if we are doing if you're playing any sports, or if you're doing any other extracurricular activities, we need that range of motion, right? All right, next. So here the slide will say benefits of range of motion. So improves circulation, it improves the muscle strength, maintains the flexibility, it reduces pain, it enhances your physical performance, and it improves your function. It definitely decreases the injury potential. Right? So next, as we discussed earlier, there are 3 different types of range of motion. So same thing with the range of motion exercises. We have passive range of motion exercises, we have active range of motion exercises, and active assisted. So passive is when the client is helped by someone else, that is called passive. And active is when the exercise the client is performing herself or himself without any external help. And as the name implies, active assisted range of motion exercise, when the exercise is performed by a client with some assistance by a therapist, right? So I just made a small clip just to give a practical overview. So let's watch the clip. Hi friends, it's me again. So as you know, today we are discussing and we already discussed about the theory of what range of motion is and what range of motion exercise is. So now I just want to give you some practical knowledge. That's why we discussed. So what range of motion is? I think the video is not playing for some reason, right? Your joint, right? So for example, I'll give you an example of neck. In neck, I can move neck in different directions, and how far I can move it, it will be the range of motion. For example, I can move my neck forward. So this is a flexion range of motion. I can go back. This is the extension. I can go on the side rotation and side flexion. So this is how far I can move my neck. So this is the range of motion of neck. Same thing with all the other joints in our body. So next, what range of motion exercises? So same thing, range of motion exercises as we discussed, and how to improve the mobility of the joint. So let's take an example of shoulder. So this is a range of motion exercise of shoulder. So I'm moving my shoulder in all the different directions on the sideways. So this is what a range of motion exercise is, right? And if you can use some weights with it, it becomes a strengthening exercise, and it helps to improve the strength of the muscle. And we already discussed in the theory about what active, passive, and active assisted range of motion is. And lastly, I just want to give you a message to my friends that hopefully all are safe and be safe and have good health, and everybody is playing their important part in fighting COVID, right? And stay tuned, and more information is coming your way. Okay, so next we will discuss is pediatric physiotherapy, because I also want to talk about some exercise which we can use in kids with disability. So what is pediatric physiotherapist? Pediatric physiotherapists are the physiotherapists who help children in achieving their optimal physical development, right? And it is a specialized field of physiotherapy. So next slide. So indications of range of motion exercises in children with physical disabilities. So there are a few examples where these range of motion exercise can be useful in kids. Kids with cerebral palsy, spina bifida, muscular dystrophy, brittle bone disease, juvenile arthritis, and ataxia. So these are few disabilities in which range of motion exercise plays an important part in the rehab of the kids. Next, please. Next slide. So role of range of motion exercises in pediatric physiotherapy. Why are these exercises so important in children? Because children with disabilities, they develop tightness in their muscles, which can lead to loss of active motion in their joints, and then possible permanent tightness and loss of movement, right?
So
Yes.
sorry, I didn't mean to interrupt you. So if you continue to do these range of motion exercises in kids as they start kids and like they, obviously
Yes.
turn into adults, can they achieve full range of motion by
Yes.
the time they're adults?
Yes, that's what it's all about. So see, if you started early in the development of the kid, that definitely will help them to attain their maximal range of motion, right? And also they help to keep the joint and surrounding areas in a functional position, right? The exercise also improves the blood circulation and promote bone growth and all other, and it can be fun for the kids to perform these exercises also, right? All right, next slide. So next question, usually parents ask, like, how should I do the exercises at home? Right? So they can be done every day, but finding time, I know it's not always easy, because it's sometimes it's hard for the parents to do exercise with the kids, right? But if they can include them as a part of their daily activities, like bathing, diapering, dressing, carrying your child, you can incorporate these range of motion exercise while performing those activities, right? And you can also do it several times a day, because we change the diaper several times a day.
Yeah, so if you incorporate it into your routine, then you're set.
Then exact, you don't have to take an extra time for it while performing those activities, right? Perfect. So next slide, please. Okay, next is, how should I do the exercises? So this is like a disclaimer here. I want to that before you start doing any exercise, you should always consult your physiotherapist or your physician or your kinesiologist, whoever your medical doctor, right? Because every child is different, and we have to make a specific treatment plan for every child. So definitely you should always consult your physiotherapist or occupational therapist before you start making any exercise plan, right? And exercise time should be non-stressful and relaxed for the kids and for the parents. So same thing, just incorporate this in your daily activities, so to make it less stressful, so you can be more, you can perform it more often, right?
Yeah, because if it starts to feel like a job, then you're not going to want to do it every day.
Do it,
yeah,
and then the kids become cranky also.
Yeah.
Right. All right. Okay, so what if my child becomes upset during the exercise, as we were talking about that? So next slide is about that. So I know sometimes, because they're small babies, they can be cranky when you wanna perform certain movements on the body, right? So you have to start slowly and move the joint in a point that where you begin to feel resistance, you need to stop. So all these things need to be learned by physiotherapist should explain you the techniques how to perform it, right? And same thing, just to distract the child, do the exercise as a part of a game, so they know as if they're playing a game. They're not doing an exercise, right? All right, next slide, please. Okay, how can I make the exercise part of my daily routine? So as we already discussed this slide, that incorporate while performing the activities of daily living, like you're bathing your kid, you're changing the diaper, or like the playtime, like they do exercise as a part of a game. Same thing like that. Right? Okay, so there are some examples in the next slide that how you can perform range of motion exercise with babies. So in first, you can see that the lady is carrying the child, and she can just move baby's shoulder and elbow in different direction just to do the range of motion. And same thing, they can stretch the shoulders back and just in tummy line position. So to get the proper range of motion, you can perform the exercise by holding the kid. So they think that they're just playing a game or something.
Yeah.
So next slide. See, as we talked about, while changing a diaper, you can just do the little range of motion exercise, lift the baby's leg to stretch the hips. So for lower extremity, you definitely can perform the range of motion exercise in that position. Next is reaching. So the way you offer a toy to a kid can also help to improve their upper body range of motion. So how they will hold the toy, how they will move their arms. So that will definitely improve.
Yeah, so instead of just giving it to them, holding it higher, so they actually have to use their arms.
Yeah, so these are very simple techniques which parents can learn, right? Perfect. Same thing with the playing. While while playing, just try to help the kid to twist their abdomen or twist their back muscles to get the range of motion of the spine. Perfect. Next slide. Yes, in this also how to perform shoulder exercises in case this baby, like elevation, lateral rotation, posterior capsule stretch. All these exercises can be performed efficiently by a parent at home. All right. Next. So next we have a geriatric physiotherapy. So geriatric physiotherapy is the physiotherapy for seniors. As you know that the goal of the therapy is to alleviate pain and return or maintain mobility and function. Because as we know in seniors, they have many problems. They have osteoarthritis, osteoporosis, and range of motion exercises can definitely help them to decrease this.
Yeah, their joints wear and tear over time as they get older too.
Yes, and it's very important that they maintain their mobility to improve their function and definitely improve their lifestyle. Right? So physiotherapy can help seniors to remain strong and independent and as well as productive. Right? So why is physical therapy is for seniors important? As we already discussed, that helps to maintain their independent lifestyle. It helps to lessening the need of prescription drugs because when you are a senior, you definitely need medication for the pain relief, pain in the joints, because of osteoarthritis or osteoporosis, brittle bones, right? So physiotherapy can definitely help to elevate those symptoms, lowering risk of injury. So, and one of the main reason of injury is the risk of fall.
Yeah, that's big in winter too. Now that the weather is getting colder, the ice.
Yes, like fall is one of the main reasons in seniors to get hip fractures or other kind of injuries. So it is very important to educate them on regarding importance of physiotherapy in preventing the falls. So these are the main reasons why I think physiotherapy is very important for seniors, and they should regularly get their physiotherapy done. Perfect. Next, please. Okay. So what are the senior health concerns? First is falls. As we already discussed, that fall is one of the main reasons in injuries for seniors. Osteoarthritis. Osteoarthritis is a degeneration of the joints. As you get old, your body gets degenerated, the joints get degeneration. The main joints is knee joint because it's a weight-bearing joint, and your hip joint, which is the most common joints to get arthritis. Next is osteoporosis. Osteoporosis is weak bones. As we age, our bones get weak, right? So in that case also, it is one of the important health concern for seniors. Because if your bones are weak, you can get fractures easily, right? Next is Alzheimer's disease, which we also call dementia. It is also one of the main concerns, especially in Canada. So physiotherapy also plays an important part in treating those patients. Next is heart disease, stroke, or mental health issues. Right? So all these problems in that range of motion exercises plays an important part in treatment of this, because range of motion is a part of the rehabilitation, which usually helps to improve the function. Right? If your joints are moving properly, if your joints are flexible, definitely it will improve the function. Okay? So it is actually very, very important. Next slide. Okay, next is fall. So fall is, as we know, one of the greatest risks senior citizens will face. Among older adults, falls are the leading cause of fractures, hospital admissions for trauma, and injury deaths. Falls are the most important cause of older adult traumatic brain injuries, and counting over 46% of fatal falls. Right? So we already discussed that we need to address this. It is one of the main concerns for seniors. Fall risks. So what are the risk factors that a senior will have a fall? So most important is balance issues or walking problems. So there are certain problems, there are certain diseases in which senior or any patient can lose his balance, right? One of the reason is the vision changes. So as you get old, your vision is affected, and if you're not wearing proper prescription glasses, so it can lead to a fall, right? Vestibular problems, like if you have any problem with your inner ear, middle ear.
Oh, okay, yeah. Listening.
So in that also, you get dizzy. Dizziness is one of the symptoms, and then which can definitely lead to a fall. Then altered sensation in the feet, like patients who have a really bad diabetes, like they have that problem. They're not able to sense their joints. Their proprioception is low.
That's insane. I've never heard of that before.
Yeah. So they don't know the sense of the sense of a joint in space. They don't know where they're keeping their foot, so they lose their balance. So it is very important to address these issues. And sometimes even patients don't even know they have these problems until they get a fall. Right?
Yeah.
They don't go for checkups or regular checkups.
So physiotherapy is a way to prevent that from ever happening to begin with.
Definitely, because physiotherapy can assess all these factors and see if the patient is at the verge of having any risk factor. So you need to address those risk factors, right? Okay, some patients, they use multiple medications. So it says that when you're taking different medications, they can have some side effects, like it can be dizziness, right? And as you know, I have like one of my friends' grandfather, he likes to take all his medications. He just they feel safe, they want to take the medication, but they don't know the proper side effects. So it's always advisable that you always see your doctor and take proper prescription medication. Just don't be a doctor yourself.
Yes, that's fair.
How people
doctor will be like, I want to take my iron pill, I want to take my B12,
my friend told me take this medication, you will be fine.
Yeah.
So no. So you make sure you see your doctor, right? Okay, next is home hazards, including like dim lighting, trip hazards. So for example, for a senior, if he has to in the middle of night, he has to go to the washroom or toilet, the lighting has to be proper. He needs to switch on the light so he can see, because there is a risk factor of tripping, right? So this is also one of the main reasons why seniors have fall, because of the poor lighting. Right? Okay, positional low blood pressure, such as orthostatic hypotension. So positional low blood pressure is when you change your position very abruptly, your blood pressure goes low, and then you felt dizzy. So it's always advisable for seniors, like they change their position slowly and they just stay in that position for at least like few seconds.
Yeah.
So they don't trip or fall or get dizzy. So this is also very important. So we need to educate them on this. Feet and footwear issues. Sometimes they have problem in their feet. So footwear, they are not wearing proper footwear, or sometimes some seniors, they are very adamant that we don't want to use a walking aid. I'm okay, I don't want a walking aid.
They want to feel young.
Yes, right. Yeah. So in that case, I think it's very important that if it's needed, they should protect themselves and use a walking aid. Next slide, please. Okay, so fall prevention tips. So there are certain tips which definitely help the seniors to prevent falls. First is, along with exercises, follow these tips to avoid a spill, right? First one is, have your vision and eyeglasses prescription checked regularly, because the prescription can change, right? And sometimes they keep wearing the same prescription, but they're not able to see clearly, right? So they need to treat their eye diseases, cataracts, glaucoma, and macular degeneration before they compromise your vision and lead to a fall. So it's always better to go for regular checkups as you age, because just to keep you on point, okay? And also check the lighting around your home. If you feel like you need a proper lighting, just address that issue also. Alright, so next is, ask your doctor to go through all your medications with you, as we already discussed, right? You should know what is the side effect of a certain medication, and you should know the prescription of the medication. Just educate yourself. It's always better, right? Wear well-fitting shoes with low heels and steady soles. So shoes, you have to have a very comfortable shoes, right? So even like now it's gonna snow. It's better to
something with good grip.
Yeah,
too
with
now. Yeah.
good grip. So avoid falling or tripping, right? Okay. Stand up straight with your shoulders even, your spine neutral. Yes, let's do that. Just keep your posture, right? So keep your posture. So good posture is very essential. So, as I know, as you age, there are certain physiological changes in your body that lead to poor posture. But try to perform some posture exercise to keep yourself.
That's not even a senior problem. That's my problem too.
Yeah. So actually, we should be sitting straight.
Yeah.
Right? We should focus on posture too. Perfect. Okay. So pay attention when you walk. It is very important. Like, leave your cell phone in your purse. I know this is not a serious problem. This is our problem.
I'm a student and this is my problem.
This is your problem.
Yeah.
So this point goes to you.
Yeah.
So when you're walking, your cell phone should be in your bag. Not
you
like
see
this.
They have like their AirPods in and then they're texting at the same time.
Yes,
Can't hear the traffic either.
Yeah. So sorry, seniors, that's not your problem. But it's just one of the points I want to address here, that when you're walking outside, just check your surroundings. Don't trip or fall, because see, some seniors, they have weak movements on osteoporosis. So even a small trip can lead to a fracture. Right? Perfect. Stand up slowly from a seated or lying position. Same thing. We discussed the low blood pressure. Yeah. So if you're changing your position, do it very slowly. Don't abruptly change the position, but that can lead to low blood pressure. That's called orthostatic low blood pressure. Change of position, and then dizziness and right? And get a prescription of vitamin D, but as per your family physician. As we know, Canadians, I think everybody's low in vitamin D.
Yeah.
We don't get enough sun.
There's not even enough sunlight right now. The sun sets at like 6.
Yes, so it's very important. Okay, next, I think I may, so there's a video, because it is, video is not working now.
So it is very important to teach them how they are safe. So let's go. So suppose I had a fall and I'm lying on the floor, right? So the main objective is to get up safely without injuring yourself further. Okay, the next step is that you have to scan yourself from head to toe and see if you have excruciating pain. If that's the reason, if that's the case, then you should always go for help. But if you think you can do it, then there are certain steps. So first step is that you have to go on your belly. For that, I want you to use your hand and slowly turn your body and go onto your belly. So once you're on your belly, again scan yourself and see if this step is very painful, then you should stop and go for help. If that's okay, we will move forward. So next, what I want you to do, I want you to slowly go onto your toes, on your knee and on your foot. So I always want you to use your good knee or your good leg, right? So you slowly want to go onto your core, and you want to look for any similar structure. It can be a sofa, it can be a chair, a staircase, anything. So I want you to crawl slowly towards the stair structure. In this case, I have a sofa, right? So next, I want you to use your knee to take the weight on. So here you go. Even if it's painful, I still want you to use it. Slowly you're gonna crawl on top of the sofa and always use a keyword. Like your weight should be on your hands and on your leg. Okay? And then you slowly just get up and sit. And take a break there and again scan your face and repeat. Thank you. Hello friend.
Okay, so I think we are back again. So can we go to the last previous slide, sir, please? Okay. So in that video, we were actually talking about how to get up from a fall safely. I don't think it was a problem with the video. I think viewers not able to watch that video, but I just want to explain it. There was some technical problem, so I want to explain what I was actually teaching in that video. So if a senior had a fall, so he's lying down on the floor, right? First of all, he should call for help. If there is no help, there is a specific technique to get up from the floor. So if he's lying in this position, for example, he needs to go on his tummy. Slowly he roll on his tummy. And scan himself or herself that if there is an excruciating pain, so maybe he injured or he had a fracture or something, then he needs to stay in that position to prevent further injury and call for help. Okay, but if he feels like he can go further, then definitely he should come onto his force. So forward we say he should come to on his hands and on his knees and slowly just crawl towards some stable surface. For example, take a chair or if there's a staircase close by, just crawl, right? So he should not just get up. He should crawl to that stable surface and slowly just get up and sit up.
Okay, so use the surface as support as you're getting up.
Yes, so slowly crawl towards the stable surface and get up. So that's what I was trying to teach in that video, and maybe some technical problems video. So that's the technique they should follow. Because the main objective of that video is that to teach the seniors how to get up safely from a fall, to avoid it from the beginning, right? So sometimes any senior had a fall and he had a fracture and he just tried to get up, so you can complicate that fracture, right? So it's always important to follow those techniques. And also we will talk about some exercises how to prevent fall. So I definitely want to address that all the seniors should incorporate these kind of exercises in their daily living, so to prevent falls and other problems, right? Okay, perfect. So while it's not possible to completely prevent a fall, but definitely we can reduce the risk of falling, right? So there exercises include as range of motion exercises, balance exercises, strength exercises, gait training, and hydrotherapy. Hydrotherapy is exercise in the water.
Okay.
And like seniors love that.
Yeah.
They love it because they don't feel their weight, and the buoyancy of the water help them to move easy, and they we don't feel any pain while doing those exercises, so they enjoy it. Range of motion exercises, I have a few examples of range of motion exercises. So first, this is sit to stand exercises. So as you can see, she's not using any support here. She just trying to get up. That's it, right? Okay. So next slide, if you're not able to do this exercise, right, there is a modified sit to stand exercise, which is in next slide. Modified that you can use your hands. You can use your hands to get up. So perform this exercise for like 10 repetitions. You can do 2 sets, like 20 times, but take a break after 10. Okay, next exercise. So this is a balance exercise. So in balance, you can see that she's just tapping her foot away, feet apart, and then close, and then she's just taking her hands off. She's just taking off the support. So just to balance. So these exercises a senior can perform at, we call them kitchen sitting exercises. You stand by the kitchen counter, and then you can use that support, and you can do these exercises. And as you can see, it's very easy exercise. They don't need any external equipment. It's very simple exercise.
Yeah.
They can perform it at their home, right? All right, next. Okay, so next, this is also a balance exercise. It's 1 foot, eyes closed. So you have to go on your 1 foot, and then you have to leave that support. First, you do it with eyes open, once you are good at it, then you can progress to eyes closed. So that also helps to improve the balance of a client or patient, right? Perfect. Okay, so that's wrap up our fall. So next osteoarthritis. I want to talk about this. Is one of the I see like 50% of my patients I see
this is what they come with.
Osteoarthritis, specifically for knee osteoarthritis, right? So osteoarthritis, as the name implies, osteo means bone, arthritis means degeneration. So osteo is a degenerative disease which affects the joints, right? And it is progressive in nature. It progresses and it gradually wears down the joints cartilage.
Yeah. So when you say progressive, you mean that it continues to get worse if you don't act on it.
Yes, because it's a degeneration, right? Definitely, if physiotherapy can help to decrease the progression and improve the function. Right? So, what is joint cartilage? Because sometimes the patient they wants to know what is osteoarthritis, right? So this is your joint, and there's a cartilage layer between the joint. So that cartilage layer there's a breakdown of that cartilage as you age, right? Because cartilage is the body's natural shock absorber. So as you know, knee is a weight-bearing joint. It's bears the whole body's weight. And with time, as you age, that cartilage wears off.
So if the cartilage in your knee was to wear off, then it would just be your bones against each other?
Yes. And that is what osteoarthritis.
That sounds painful. Yeah.
It's very painful, and that's why it's at the end patient needs to go for replacement.
Yeah.
Right. Okay. So common joints affected is knee, hip, spine. So mostly I see patients with knee joint. That's the most common.
Yeah. So when you get a knee replacement, it's usually the disc that they replace, right?
Yeah. It's a tri-compartment. They replace the whole they replace the full joint. That's the most common. So what symptoms of OA? OA is osteoarthritis. So stiffness, pain in the joint. So even you get bone spurs. Bone spurs is there's tiny formation of bones on the side, very tiny ones, and that actually cause a lot of pain when the patient walks, right? Reduced flexibility of the joint, the decreased range of motion of the joint because of the pain. It's hard for the patient to move the joint to the full ability. Clicking or cracking sounds. Patients sometimes
I have that.
So no, I don't think you have osteoarthritis.
I hope not. I played a lot of sports in high school. So
yeah, so
hopefully not.
No, crepitus can happen, but do you have any pain? Yeah. Okay, so you
go to my doctor after this.
No, come to White-OK.
Okay.
Yes. Okay. So clicking or cracking sounds, like patients when they hear crack, we call it crepitus, they always oh, my joint is always clicking. What's going on, right? And swelling. They can be swelling also. Sometimes a lot of swelling too, right? So these are the symptoms patients should not ignore, and they should get help. Right? Perfect. Okay. The bird was nice,
That was cool. Yeah.
Yes. Okay. Home exercise program for OA of knee. Okay. So next, it is so the best thing about osteoarthritis is the exercises are so simple, patient can perform at home. They're very effective exercises and very easy exercises, right? So I think most of the patients they usually comply with those exercises because they're simple, they're easy, and it has really good results too. Frequency, so they should do 10 reps, 3 sets. That's what recommended. So 10 times and 3 sets.
Yeah.
Right. Take a break as needed. So these are the advice which usually I give to my patient before they start doing exercise. Keep hydrated. So always make sure that you're drinking enough water, you're hydrating. Always warm up with brisk walk for 5 minutes. It's always important to warm up before doing any form of exercise. Because if you're not doing proper warm up, it can lead to injuries. Yes. So static bike is very effective mode of exercise.
Really?
Yes. And I want to explain why. Because a lot of people they know that walking is good, but static bike is better than walking.
Because it uses the full range of motion.
Yes, and other thing, because static bike is a closed chain exercise. So it means that the foot is stable. So your foot is stable, you're just moving your knee. And while you're walking, you're even moving your foot, right? So a lot of weight on your knee. But when you're doing bike, there's no weight on the knee. That makes sense?
Yeah, that does make sense.
That makes sense, right? So it is very, very important to do static bike. Like for all my patients, and they have really good results while doing the static bike, even for 10 or 15 minutes.
Okay.
Yeah. And see, in winters, it is more.
You can't go biking in winter.
No,
Yeah.
static bike, like at home,
Yeah.
the bicycle, right? But in winters, like walking is a little bit hard. You cannot go out walking, but you can do static bike at home,
Yeah.
right? Okay. But always consult your physiotherapist before you start any home exercise program. So this is a disclaimer here again. So you always talk to your physiotherapist first before you perform any exercise. Perfect. So let's go with the exercise. First is the hamstring stretch. So as we know, hamstring is a muscle at the back of our thigh. So this is the way to stretch the hamstring. You can just take any sheet or you can take a TheraBand and just hold it. Always hold the stretch for 30 seconds. 30 seconds. The patient, they're like, oh, I don't feel the stretch. How long you hold the stretch for? 5 seconds. Sorry.
Yeah, no, I played basketball and we did stretching and it was for 10 seconds.
So at least 30 seconds. You need to stretch that muscle. It takes 30 seconds for a muscle to get stretched. Okay? Always, even if you have pain in only one knee, I always recommend you to perform on both knees. Because eventually your other knee is going to give up. It's called compensated pain. Because the other knee is taking so much load. So eventually it's going to give up too. So it's always best to, perform exercise both sides. Calf stretch, right? This is, I think, it's universal. Everybody knows this. You can use a chair to stretch the calf. Same thing, 30-second hold, and 3 times, 3 to 4 times is perfect. Perfect. Next slide. Okay, straight leg raise. It's isometric exercise for your this big muscles, front of your thigh, quad muscle. So you just 45 degrees. Yeah, you just elevate your leg for 45 degrees and then just hold it there for 5 seconds. Now you do 5 to 8 seconds and then you perform this for 10 times. Okay, but one mistake patient do here is that they elevate the leg too high, and then that can patient can get back sprain or strain. So it's recommended to always just lift your leg just 45 degrees to 50 degrees, not beyond that. All right? Perfect. Okay. So this is quad. Quad is called quadriceps muscle. It is the muscle of the front of your thigh, and it is one of the most important muscle which supports your knee. So what you do, basically you just contract that muscle. You can even put a rolled towel under your knee and just put a pressure on that towel. So basically contracting that muscle, and you hold the contraction for 5 seconds to 8 seconds. So it also helps to improve the strength of that muscle. So basic idea is, see, we cannot change osteoarthritis like it's happening, but if you improve the strength and flexibility of the joint and improve the strength of the muscles, they can support the joint. Yeah. Okay. So seated hip march. So while sitting, you just elevate your leg, just doing like a march. You march, right? This is also a great exercise to improve the strength and also to improve the range of motion.
This everybody can do, especially at COVID when you're like working from home, sitting at a table.
Yeah.
This is all stuff that you can do easily.
Yeah, so this is that you don't have to go to gym or you don't need any expensive equipment to perform this exercise. Very simple, right? Perfect. Okay, so next is heel raise. Like you can use a chair to support yourself and just perform this heel raise. It helps to improve the strength of your calf muscle. Same thing, do like 10 to 15 reps and 3 sets. It will help in the strengthening of the calf and definitely improve the mobility of your foot. Right? Okay, next is side leg raise. Side leg raise also, you can take a support of the chair and just you have to move your legs to the side and just perform that range of motion exercise, and it also helps to improve the strength of the muscles around the knee. Perfect. All right, it's about time. Question time.
Okay, sorry. Just 1 second.
Yeah.
I had a question about. So all of the exercises that you just listed, they were for osteoarthritis, right?
Yes, they were for osteoarthritis. We can incorporate those exercises in other problems of knee joint also, like some seniors or some of my patients, they have meniscal injuries or ligament injuries in their knee. So
that's what I had last year. That's why.
yes. So if you use some ankle weights with those exercises, like straight leg raise, if you use an ankle weight, it becomes a strengthening exercise. The hip marching, if you use an ankle weight, it becomes a strengthening exercise. Right? So that helps to improve the strength. So you can use those exercises for your knee also, because these exercises are quite universal.
Yeah, because that's what I was thinking. A lot of them are so easy, like heel raises. If somebody's like washing dishes or you're waiting in line,
Yes.
that's so easy to do.
Yeah, so a lot of athletes, and they do those exercises to improve the strength of the calf. It's not that it's only exercise for patients with OA. Like if patients have any ligament injury, any sprain, strain, any meniscal injury, or of Achilles problem, like a calf strain, they can do those exercises.
You can like modify these exercises to make it harder if you're younger and you're more flexible.
Yes.
You can add weights to them, and then if you're older, you can just do the most basic version of the exercise.
Yes, so you without using any weights. So for seniors, right?
Yeah.
So you can modify it accordingly. So definitely exercises also.
I will. Now I will. Are there any other questions? Recently, no, I haven't. I used to play a lot of sports. I had an injury and I had a ligament, just like slightly partial tear.
Yeah.
Doctor gave me some exercises to do. I did them, didn't do them, did them.
Yeah, that
But
happens, right?
yeah.
You have to be compliant with your exercise program
Yes.
to see the results, right? It is very important.
Oh, okay. So one of the questions we have is, how can children with disabilities do home exercises?
Yeah, so yes. So see, there's a certain protocol we need to follow, right? We need to assess the children with a disability, like what kind of disability the kid have, and then we have to make a specific treatment plan for that specific disability, and teach the parent to how to perform exercise for the
So
kid.
the parents can do the exercises with the kids, right?
Yeah, so as we have seen in the previous slides, that how a parent is doing the exercise for the kid, like while changing the diaper or while playing with them games.
Yeah.
So how you performing the range of motion exercises. So definitely we need to teach the parent first so they can perform their exercises at home.
Yeah.
It is so I recommend parents not to always consult the physiotherapist before performing any exercise.
And the next question is, due to COVID, all senior community programs are on hold. What can they do at home?
Okay, yes, it's a very good question. So as we already showed you, the exercises, the balance exercises, even if you don't have any issues with balance, it's very important if you do those exercises.
Because it becomes preventative,
Yes,
right?
it is very important. Preventive care is very important in seniors. You don't have to wait for those symptoms to come. You can just, start doing some exercises, like a static bike. If you have at home, definitely it's very important, because degeneration, it's inevitable. Like eventually we're gonna get it, right?
Yeah, it's gonna affect everybody.
At one point. So it's just for the general well-being also. So and as we taught the range of motion exercises, so they don't need any equipment. You can perform at home without any expensive equipment. Just you just need the support, like a kitchen sink exercises, for example. You can just while
how can we approach you?
Oh.
How can we contact you?
Yeah, so yes, my clinic is in Brampton, so it's called Vital Care Physiotherapy. It's at 375 Houghton Boulevard. It's a Dixie and William Parkway area. So I think if you will Google it, you will find me. It's
Okay,
easy.
perfect.
Yes. Yeah, we have some resources, some references our viewers can take a look at and use those resources also.
Thank you so much for joining us today. Thank you for providing us with all of the information that you did. And this wraps up our webinar for today, but I'd like to talk about the webinar that we have coming next Thursday from 7 to 8 p.m. And this one is going to be about learning disabilities and management during COVID, which obviously is a very important issue because social distancing measures, you can't really go out anywhere.
Yes.
Okay, once again, thank you so much for joining us. It was nice to meet you.
My pleasure.
Oh, sorry. And please register online for the event. You can visit www.krishhope.com for registration. And once again, it'll provide you with the link to the webinar or the Zoom call that you can connect from.